steps to the left if you haven't already done it.
Sorry.
Can anybody touch their toes?
Oh, yeah.
While being appropriate to the friends around you.
They knew the risk. They knew the risk.
Mark, do you need a clicker?
Yes.
Okay.
It would be easiest if
Absolutely.
Get that runner stretch going.
Evan is doing the runner stretch. If you'd like to join him, stretching your hamstrings and calves.
Like, is that feel more satisfying?
It's the true runner stretch.
All right, and then we're gonna
Here's
have
the
to
thing.
take it back down.
I'm not a runner.
Made me stand up, now you want me to sit there now.
I started to.
I skate like crazy. I skate like the wind.
I'm just waiting for the weather to just like stop dropping. That's it.
Do what Brittany said.
On ice, I'm so good on ice.
Do you like prepare on your shoes that you can just change automatically to skate?
No, I wish. It's a 10.
Is it not going right?
It's what it is.
Walking that far.
All right, you guys, we're gonna get started. I have the pleasure of introducing Mark Longshore and his doctor. Dr. Longshore. All right, so Dr. Longshore is the president of the Colorado Nurses Association. No big
Close
deal.
enough. Executive director.
Or that.
Board gets a president.
I mean, it
I'm the
feels
executive director.
presidential. The king of the Colorado Nurses Association. And he is going to come talk to us about some of the politics that happen and make our state run how it does. Hopefully you can solve a little hunger while you're at it.
Sure, I'll work on that.
All right, so you guys can just thank him for being here.
Okay, so yeah, every time I'm introduced as Dr. Longshore, I always want to follow it up with I am a registered nurse, just for the sake of clarity. But at the same time, I think it's important for nurses to let other people know about the education that we all have. Okay, so with that, I actually want to start with a little quiz. And so, seriously, when I was over there, it was clicking just fine. Okay, I did it. Maybe it's just the distance. Yeah. Okay. So, I was looking at some of the name tags out here. How many people have a graduate degree in nursing? And I understand that there's more than just nurses in here. Okay, so a lot of you. How many have a bachelor's degree? And well, I should say, and not a graduate degree. Sorry.
Not in nursing.
Okay, not in nursing. Okay, good. The reason I asked that question is that my dissertation looked at nurse educators and their political astuteness and their political self-efficacy. And the big factor that that correlated with a higher degree of political astuteness, which is basically knowledge of politics and how things work, was graduate education. Okay, and then the thing that correlated with self-efficacy, in other words, kind of having the self-confidence, if you will, to act politically, that connection was membership in a professional organization. So how many of you are in a professional organization? Yeah, good number, yeah. And I didn't dig any deeper into that, but I suspect that has to do with just the mentoring and such that takes place in professional organizations, as well as in meetings like this. So it's great to see so many nurses getting together and just kind of talking about how things are and how things can be, okay? I'm gonna skip the third question just for the sake of, I've got a little less time than I thought I had. So let's move into some of the other stuff here. And I guess, yeah, I think I'm gonna have to walk over a little bit closer there every time. So some of what I'm gonna say is, some of you are going to be like, oh my gosh, why is he treating us like we don't know anything? And that is not at all my intention. A lot of the stuff that I've added to this presentation has come from questions that have come to me as the executive director of CNA, as we get more involved in politics and some of our members that are involved in other committees and groups and such within CNA have come up with a lot of questions. So I've really tried to add a lot of stuff, kind of basic level, just to make sure that everybody has that at least kind of fundamental knowledge of our political structure. Okay, so starting with that, the sources of law, this is the question I think it's safe to ask. So what are sources of law that nurses need to worry about? And again, I'm saying nurses, but I understand that there's other professions in here as well. So where do laws come from?
Safety, public safety.
Oh, okay, so that's a big reason for the laws, yes. What, maybe I should ask, what part of the government makes laws?
Legislative.
Legislative branch. Okay, final answer, anybody want to add anything?
All three of them? All three of them?
All three of them, yeah, and all three of them, and I've got a slide for each of those, is, yes, the legislative branch is what most people think of, and that's where I would say I spend most of my time, is working with the legislators down at, I'm from Fort Collins. I was about to say down in Denver, but I'm in Denver. So yeah, legislative branch is what I work with most closely. But yes, the executive branch, the judicial branch, they all pass something that in essence is viewed from our point of view as a law. Okay, it might be a court ruling, it might be a rule from the executive branch, or it might be a law from the legislature. But nonetheless, we have to follow those, right? So yeah, so lots of or several sources of law, and theoretically, each of those branches is supposed to kind of have a check on the other two branches, right? So that's how our system is set up. And then we've also got the branches of law, and there's so much overlap here because, I like to think of criminal law as the state versus whatever. If I, as a nurse, I go up and I take somebody's blood pressure, and they don't want me to take their blood pressure. They've told me don't take my blood pressure. That's actually a criminal infraction, right? Well, technically I'm holding them in place, so that could be considered, assault. Well, it's actually, it is battery. Yeah, that's the easy one to get to. I was trying to think of another word for something else, but yeah, so just touching them is battery. So yes, I theoretically could be arrested for doing that. In the same way, with workplace violence being an issue, with patients or families or whatever hitting healthcare workers, of course, that is also battery. So we have that ability, if you will, to press charges against people that hurt healthcare workers as well, right? So that's criminal. The next step down is civil. So that is Mark, or patient versus Mark, right? So this is not a criminal thing, but that patient who I held down and said, no, you're not allowed to leave because I'm going to take your blood pressure, they can now come back and sue me, right? Because I did something they didn't want me to do. Most of the time in healthcare, when we talk about civil, we're talking about malpractice, right? And these are the 4 factors for malpractice. So a duty to do something, a breach of that duty, some damage or some injury happened, and then there's causation. So that breach of duty caused the injury to happen, okay? That is, in my experience, and I've also been a nurse educator for many years, that is a large part of what nursing schools teach nurses about the law, but it's just one little tiny piece of it. And that's why I love to do these presentations, is to kind of expand what healthcare workers know about these different areas of the law and how you can get involved in it, really, okay? And that goes back to my earlier question about how many of you have graduate degrees, because in nursing, 80% of nurses do not have graduate degrees. And yet, again, the research finding that that a nurse's knowledge of how politics works is correlated with their graduate program. So 80% of nurses are not getting the information they need to be active in health policy, okay? And then lastly, I put down here is administrative. Administrative is, we'll talk about more of that in a minute, but it's the executive branch basically. So things like the Board of Nursing or the Board of whatever other profession is in this room, that board has the ability to apply rules to you, right? To take your license away, or to require mental health treatment or things like that. So that's the administrative branch. This is the part that's probably heard about the least, but how many people in here have a, I would say, healthy fear of the Board of Nursing? Yeah, the Board of Nursing is not here to protect nurses, it's here to protect the patients. So back to that idea earlier about safety, okay? So those are kind of the three branches of the law and the three sources of the law, is how I like to divide those. Okay, so now the legislative branch, and this is an area that I specifically added stuff because of some questions that I had been asked by members. So it's important to know that when we talk about the legislative branch, there are of course two legislative branches we talk about, or that we need to pay attention to, right? So there's the federal, so we've got the Capitol at the top there, the US Capitol I should say, and then there's the state legislature, or in Colorado, the General Assembly, okay? So that's the Denver Capitol, the Capitol Dome there. So yeah, it's important to remember that we do have to pay attention to those laws that are being considered at both the state and federal level. At CNA, we focus primarily on state issues. Our national organization, ANA, focuses more on the federal level issues. So I don't have that much of a relationship with our senators and representatives in Washington D.C., but we are kind of increasing the relationships that I have with the state legislators, because the state tends to have a more direct impact on our practice. Within both the state and federal level, there are two chambers, so the House of Representatives and the Senate. And you can see down here at the federal level, 100 senators, 2 per state, and then 435 representatives. At the state level, we've got 35 senators and 65 representatives. And so again, this is the legislature. This is where most people recognize that our laws are coming from, okay? And then at the bottom, I just for the sake of some nomenclature there, so statutes or laws, or sometimes together statutory laws, is what the kind of the product is of the legislature. And a couple examples of some of the, oops, yeah, went too fast. Okay, so a couple examples up there. One is ICANN. This is the bill that unfortunately has been introduced and reintroduced for at least 3 years now at the federal level, improving care and access to nurses. This, the law basically kind of expands what, basically compensation. It increases access to certain things that nurse practitioners currently can't provide, but if this passes, they would be allowed to provide, particularly under Medicare. So again, I've followed that the past 2 years. It gets introduced, and for whatever reason, it goes nowhere. So we'll see what happens this year. And then of course, EMTALA, I think most nurses are aware of EMTALA. That's the Emergency Medical Treatment and Labor Act. It requires that if somebody shows up to the emergency room, they at least get a medical screening. A lot of people say that it means we are required to treat them. That's not the requirement. The requirement is to have to get a medical screening. And that is to prevent patient dumping. Okay, so that's a very valid law. The state of Colorado right now is actually working on a kind of a state level EMTALA, as well as some other laws, because there's concern that certain certain bills might be withdrawn, might be repealed at the federal level. So the state legislature wants to make sure that we still have an EMTALA and we still have some other rights available to the folks here in Colorado. So that is that's very important to pay attention to. Okay, the executive branch. So this falls under either the governor or the president. Okay, and what they put out are called executive orders. And it's important, again, to remember that these have as much power as the laws that came out from the legislature, okay? So we have to follow executive orders. We have to, most recently for Colorado, I think COVID was the source of a lot of executive orders. And what's a significant advantage of an executive order over a statutory law? Time, yeah. Yeah, that governor can sit down today and write something out and say, here it is, it's posted, you have to start following this tomorrow. And of course, at the federal level, we've seen a lot of executive orders come out over the past few months, and that's a way to I do want to say, I mean, circumvent the legislative process, but at the same time, it was set up because sometimes we need to circumvent that kind of dragged out legislative process. There are, again, checks on that. So at the bottom here, the judicial branch, of course, can overturn any of those executive orders. They look at the existing statutes, they look at the Constitution, and they say, you can't do what you just said you wanted to do. Okay, so that's one check on it. And also the legislative branch can override, because the legislative branch is ultimately responsible for passing laws, even though they let other people do them sometimes. They do have the right to come in behind and say, yeah, we see that you wrote that executive order, we don't like it, we're gonna pass a law that negates your executive order, okay? I bring that up because when we talk about healthcare and we talk about lobbying and such, it's not just talking to those state legislators or the federal legislators. Sometimes, CNA meets with the governor's office every month, not the governor, but their aides. And so we have that opportunity to talk about some of the ideas that the governor is considering. And basically we can kind of give our feedback, our input on what those are going to be, and hopefully have an impact on what the governor and the other administrative agencies decide to do. Okay, so again, not just the legislature. Some examples of that are, okay, quasi-legislative. I say that because again, they're not the legislature, but they can still make these things that are almost as impactful. But some of the things that CNA has been involved in is modifying the rules for prescriptive authority, specifically the mentorship required for prescriptive authority for APRNs. I'm currently working with the Workers' Comp Division to modify what's called a third visit rule that requires a physician to see the patient if that patient is only being treated by APRNs or physician assistants. Okay, so again, that falls under the executive branch. And then of course, nursing licensure. That's the contact that most of us have with the executive branch. Okay. Let's see, executive orders. Agencies, agencies like the Department of Regulatory Agencies, the Board of Nursing is under DORA. We've got the Healthcare Policy and Finance, which is basically over Medicaid. So that's one of the largest budgeted agencies in the state. The Colorado Department of Public Health and Environment that regulates hospitals. So these are all agencies that fall under the executive branch. Okay. Okay, and then finally judicial. Judicial, I think, is so funny because, many years ago, there was this big court case, Marbury versus Madison, where the Supreme Court ruled that they have the authority to basically look at anybody else's rules and laws and determine if they're constitutional. They did that in interpreting the Constitution. I just think it's kind of funny that for an entity to be able to interpret something in a way to say that we're allowed to interpret something. So nonetheless, that is the court case that many years ago gave the Supreme Court all the power that they have to essentially regulate the other two branches of the government. Okay, so that was a very big case. Dobbs v. Jackson's Women's Health Organization, of course, was the recent ruling that overruled Roe versus Wade. So I put that up there just to give you an example of how significant the rulings of the Supreme Court can be, whether, again, at the state level or at the federal level. We don't have a lot of pull with, and by we I mean anybody. The courts are really designed to run fairly independently, but the ANA does sometimes provide what's called amicus briefs, basically kind of input to say, you know what, we're experts in this area, we're experts in nursing or in healthcare, et cetera, and this is kind of why, this is what we think you should rule, and this is why we think you should rule that way. So they can provide some input, but whether the courts are not, because they're not elected, they don't necessarily worry so much about external input. They're more focused on, what does the Constitution say? What do we have to do to stay within the law? Okay. And then Loper Bright Enterprises, I don't expect you to look any of these up, but I just want to throw these, a few of these out here. This is sometimes referred to as the Chevron deference. Historically, again, based on a Supreme Court ruling from many years ago, the courts have allowed the agencies, again, like CDPHE and HCPF and things like that, and I will say at the federal level, the EPA and such, FDA, they've allowed the experts in those agencies to do a fair amount of interpreting of the laws that Congress sends them. Okay, and the rationale behind that is who has the greater expertise about the environment, the EPA or the Supreme Court? The EPA, right? So that's the reason for that deference. They said, you know what, Congress passed this law, but Congress isn't the expert, nor is the court system the expert. This agency was literally set up to monitor things within the environment. So they gave a lot of deference to allow the EPA to interpret some of those rules. The Supreme Court recently basically undid that and said, no, if there's a lack of clarity with a law, EPA is not allowed to decide what that rule really meant. You have to go back to Congress and say, Congress, you need to change that law, okay, to give us the clarity that we're looking for. The only, I guess, good side that I would say to that is if it goes back to Congress, we now get the ability again to provide input and say, this is how that law should be, right? Write it the way nurses think it should be written, okay? So that's the only benefit of it. But again, it does kind of take away the decision-making power of those individuals that really do have the knowledge to make those decisions. And then at the bottom, malpractice, criminal cases, et cetera. The court does other stuff too, but we're generally not involved in those, right? Okay. So what gives nurses power?
I heard somebody say caffeine.
Okay. At times.
Feel powerful.
How about in the political process? What gives nurses power?
Our voice.
The Department of Regulatory Affairs.
Okay, the Department of Regulatory Affairs it puts a lot of rules up for us. Yeah, they are definitely a power within nursing.
People?
The people. How many nurses are there? Lots. Depends on what you look at. 4 to 5 million nurses in the country. Our state board of nursing has a list in Colorado of 80,000 nurses. About 40,000 of them seem to be active. Others, I'm not sure, retired or whatever, but still, up to 80,000 nurses just in Colorado. So that's a lot of power. It has been said a lot that if nurses voted as a single block, we would be incredibly powerful. But nurses are just like everybody else. We have different political leanings. We don't vote as a solid group, okay? But nonetheless, that is definitely one thing that gives us power. Most of you have probably heard, year after year, nurses are considered the most trusted profession, right? That gives us power. The public trusts nurses. So I can tell you down at the Capitol, when nurses talk, whether it's the CNA or a lot of other nursing professional organizations out there, when nurses talk, people listen. The legislators listen. They actually reach out and say, hey, this is my bill, I'm about to introduce it. What do the nurses think about it? Okay, so nurses have a lot of power. Nurses tend not to use the power that they have. So that's my biggest push here for everybody is to recognize that you have that power and to use that power. Whether it's to improve your own working conditions, no offense against Van Health, okay, I'm just gonna say, but also, we look a lot at what our patients need. So, we're looking at supporting the safety net or supporting funding for Medicaid, supporting different programs for the most vulnerable folks in our population. So again, nurses have the power and they're recognized and trusted as being ethical and trying to help others, okay? So use that power. What takes nurses' power away? Nurses?
Politician.
Okay. Politicians, how do politicians take it away?
Well, they're making decisions and laws and rules for us that may not always be realistic.
Yeah. So that comes up a lot of, I can't believe you guys came up with this bill, or you passed this bill without reaching out to the nurses, because this directly impacts nurses. And again, we are knowledgeable, we are ethical, we are trusted, come to us. Yeah, so definitely politicians sometimes mess us up. How do nurses?
By not recognizing or utilizing the power that we have.
Okay, good, yeah. So by just not using the power, by kind of giving it up, yeah. And and another thing that takes powers away is that there are other groups with more money. So physician groups often come out, particularly against APRNs. Sometimes hospitals come out and other employers will come out against particular bills that will complicate administration of healthcare. So sometimes there's other groups that have power, whether it be just society gives them the power, physicians, or money gives them the power. Okay, so sometimes other groups can take some of that power away.
I also think the corporatization of our healthcare system. I mean, we have seen this with joining a larger organization. The more that decisions are being made across state lines and higher up and just more levels of management, I think we have to be more and more mindful, because it can have the effect of limiting scopes of practice in an effort to standardize, and it makes that advocacy more difficult.
I agree 100%. And it goes back again to the fact that we have the power, nurses have this power. And I keep forgetting, and other health professions. So we do have that power as experts, yeah. Woodhull is a study that was done back in 1998 and then repeated 20 years later that basically looked at the power that nurses have. And it looked specifically at the media and how nurses are reached out to for input. And what they found 20 years ago was nurses don't have much power. Nurses are not consulted. Even when somebody says, hey, we have a question about what the nurses are doing at such and such hospital, the reporter would tend to go to the chief of medicine to get that question answered, or some other level of administration, but not coming to the nurses. So the kind of the lesson then 20 years ago was nurses should reach out, not just to the legislators, not just to the Board of Nursing and such and the other rule makers, but our own newspapers, opinion pieces, being involved in the community. So basically reaching out to journalists to say, hey, this is coming up. I'm a nurse. Would you like to hear my thoughts on it? This is my position. This is why you should listen to me, and actually be more active again in exerting the power that nurses have. The depressing part is that 20 years later, they redid the study. You see up there, spoiler alert, it hasn't. It actually did change in those 20 years. It got worse. So nurses were less represented in newspaper and magazine articles 20 years later. So that was a big surprise. But again, it goes back to really asking nurses to be more involved and to kind of step out of our comfort zone and recognize that policy and being engaged in that arena is part of our ethical responsibility. I still talk to a lot of nurses that say, politics are dirty, I don't want to get into that, I'm really going to focus on taking care of my patient. How can you focus on taking care of your patient when you don't have any power and the state keeps cutting the budget for healthcare? So yeah, it might be dirty, but we need to step up a little bit. Huh? 5 more minutes. Okay, Institute of Medicine, read it, it's interesting. Democracy's power leads to, it leads to burnout. Whoops.
Race to the end.
I hit the wrong button. The loss of power actually leads to an increase in burnout, because, nobody likes to work, nobody likes to feel powerless, right? Yeah. And if we feel powerless, we're less likely to want to keep working in that environment. So the idea of taking the power that we should have should actually reduce the nursing shortage. It should increase retention. So some of those numbers that were up on the screen earlier about retention at Advent Health, if nurses feel more in control, they are more likely to stay working where they're working. Okay. So now the 5 minutes. All of these, you should have access to these. I actually gave the slides to Michael, so you'll have all the links. But vote A and A. you can see that's mostly voter information, becomes more important around, you know, September, October, November. But ANA has a lot of resources that you can use. It talks about some of the federal legislation that ANA is paying attention to and providing testimony on. It also talks about, this link gets to the federal agencies. So again, looking at that executive level, Health and Human Services, there was a law passed last year, or I'm sorry, it was a rule from the Center for Medicaid Services that required higher staffing at nursing homes. Again, Congress had the opportunity and continues to have the opportunity to strike that rule down, but at this point, it's still moving forward. So staffing at nursing homes should get better. But again, that link will get you to what ANA is doing about that. Colorado Nurses Association, we have what's called GAP, it's Government Affairs and Public Policy. We meet during the legislative session, the second and fourth Wednesdays, and we talk about the bills that are up, and we debate them, and then we decide whether or not to support them, oppose them, monitor them. Again, the legislators listen to that. There's a bill about ID badges that they keep reaching out. Okay, we've made some amendments. Now will CNA support it? We're still not supporting it. But again, they reach out for our input. So, and we discuss those at GAP. So CNA member or not, you're welcome to join those. If you follow that link, it'll get you to the site where you can register for our upcoming meetings. And then at the bottom, I just put a couple, these are really patient advocacy groups. I put them up there because the headline there is learn. How do you learn about this stuff? Well, CHI and CCHI provide a lot of information about legislation that maybe CNA is not really paying attention to because it's not quite nursing enough, but it still is healthcare related. So depending on what your interest is, those two groups and a lot of other groups out there are great places to learn about healthcare and how it's impacting folks. Taking action, we had our day at the Capitol February 18th. We had 120 nurses registered, and that was a day that we got to go, members and non-members of CNA, we went to the different chambers, we went to some committees, we heard from the Lieutenant Governor about kind of the executive branch's outlook on healthcare and such. So that was a really good day there. Providing your testimony, this is the link to sign up to provide testimony. You can also if you just Google Colorado Legislature, you can get to a list where all the bills are listed. You can search them and find out what is of interest to you. And then again, you can do testimony in person, you can write a letter, you can do it over Zoom, but let them know, I'm a nurse, this is what I think, this is why you should vote the way I want you to vote, okay? So providing testimony is very important. Writing your representative directly, there's a link to find your legislator if you don't know who it is. Meet your representatives. I put a little link down there for Michael Janae's listening session. But a lot of the legislators have listening sessions or town halls or whatever they want to call them, but those are opportunities to meet with them face-to-face in the community. Just last week I came down to Denver to see Senator Coleman, Representative Gilchrist, and Senator Ball. They had a town hall where they kind of talked about how they're trying to protect Medicaid, how they're pushing back at the federal level, and really, again, how everybody else can be involved. So those listening sessions are great opportunities to just get your face in front of the face of the legislators. But also, in my experience, they are perfectly happy for you to stop by the Capitol and meet them in their office. Most legislators want to hear from you. They represent you. They want to know what you want them to say. Okay, so do that. I think that's roughly the last slide. I'm getting closer and closer to getting forward. Okay, yeah, bill analysis and discussion. Yeah, that's the bill tracker from CNA you can look at. Remember, it's not just at the state level, so cities pass laws, HOAs pass laws, right? If you live in a place with an HOA, those rules impact you, so get involved with that. How a bill becomes law, it's on the slide, it's also at the legislative website. And this is my closing thought, and I will jump to the end. This is John Adams, right? He became president of the United States. But this was early on. A more extensive knowledge of the realm, the colonies, and of commerce, as well as of laws and policy, is necessary than I am master of. So he felt that he didn't know enough to do the early work that he was doing as this country was being formed. And yet he did it and he became president. So if he can overcome his doubts, I would encourage all of you to overcome your doubts, to get involved in policy work. Okay? And the last slide, let's see, there's a couple of references, and I just want this last slide up here for my email address. In case you have any questions, if you want to join CNA, let me know. But yeah, any questions about policy, or if you want to get more involved, feel free to reach out to me.
Are you willing to hang around for about 5 minutes while we go to our break and people can ask you questions as well? What do you guys say for Dr. Martin? Thank you so